Hi, my name is Madison Stanley, and I will be working with Salvatore D'Angelo on our Assignment 3 General Medical Conditions project. Our condition was hypertrophic cardiomyopathy. Our main focus on this condition will be the etiology of hypertrophic cardiomyopathy, signs and symptoms of this condition, the diagnostics and testing criteria, treatment and proper management for this condition, the return to play criteria and considerations, and how it affects the athlete. The etiology of this medical condition is that the heart muscle thickens, and it occurs at the septum between the ventricles and below the aortic valve. When the walls of the heart thicken, this causes an abnormal aortic and mitral heart valve function, which may stop normal blood flow out of the heart. And this disease is typically inherited. The signs and symptoms involved with this condition are as follows: shortness of breath, especially during exercise, chest pain, fainting, dizziness, fatigue, sensation of rapid fluttering or pounding heartbeats, also known as palpitations, heart murmur, which a doctor might detect while listening to your heart, rapid or irregular heartbeat, difficulty breathing, and again, chest pain. The diagnostics and testing criteria are to be considered if patient has unexplained symptoms, family history of premature cardiac disease, or ECG abnormalities. Diagnosis is confirmed when the wall thickens of 1.5 centimeters or more. Tests used to diagnose heart wall thickness, problem with blood flow, or leaky heart valves include 24-hour Holter monitor, which is a heart rhythm monitor. Electrodes are stuck onto the chest and attached to recording monitor. This records the heart's electrical activity. Cardiac catheterization, passing a thin, flexible tube through the groin or the arm into the right or left side of the heart. Also, a chest X-ray and ECGs, which record electrical activity of the heart. This image displays how a normal heart would look like versus a heart in which hypertrophic cardiomyopathy is displayed. As you can see, the hypertrophic cardiomyopathy heart has an enlarged heart muscle, while the normal heart does not. This image shows that an athlete's heart versus a heart that has cardiomyopathy are very similar. It is very hard to tell whether or not an athlete's heart is normal or it has cardiomyopathy.
Unfortunately, there's no cure for hypertrophic cardiomyopathy, but every patient should always follow their doctor's advice about exercise and medical appointments. Some that show symptoms may need medication in order to help the heart contract and relax. These medications can relieve chest pain, shortness of breath when exercising, and they can contain beta blockers and calcium channel blockers. Those who have arrhythmias may need medicine to treat the abnormal rhythm, blood thinners to reduce the risk of having a blood clot, a pacemaker to help control the heartbeat, and a defibrillator to recognize any life-threatening rhythms. In some severe cases, if the blood flow of the heart is severely blocked, the symptoms can become very severe. A surgery called surgical myectomy can be done to help fix the problem. Those patients who had had this surgery done have shown significant improvement. Return to play criteria. If the athlete is playing in a competitive sport, the athlete cannot return to play. However, they can play low-impact activities based off of their clinical status, degree of potential outflow obstruction, and relative risk of arrhythmias. But an important note is, specific recommendations should be individualized by the treating cardiologist. How it affects the athlete. Sadly, if the athlete is playing a competitive sport, they can no longer play that sport because they deal with the possibility of sudden collapse or increased heart failure. They must consult with their doctor about any level of activity that they can play, and the doctor may inform them that they have to stay away from strenuous exercise.